Welcome to a brand new episode of We Clinic. As usual, we'll be having a new topic for today, and the topic for today is diarrhea disease in children. So, Mark, can we get to know you, Doc?
Yeah, I'm Dr. Nwali Daniella Choma. I'm a public health specialist.
Okay, great, and welcome to our show. So, Mark, can you quickly explain to viewers at home what do we understand by diarrhea diseases?
Diarrhea, as we know, that is the third leading cause of death and mortality in children, especially the under 5. Is a cause of malnutrition in children. Diarrhea is the passage of 3 or more loose stool or liquid stool in a day, more than normal for a person. There are several causes of diarrhea which will be explained in this program, but there are 3 clinical and classical types of diarrhea. The first one is acute watery diarrhea, which is diarrhea, a passage of watery stool lasting for 3 days or hours. There is bloody diarrhea, which is diarrhea with associated blood in stool. There is persistent diarrhea, which is diarrhea lasting for 14 days.
All right, thank you very much, Doc. So, what are the commonest causes of diarrhea diseases in children?
Okay, there are several causes of diarrhea disease in children, but the commonest is infection. Infection, which can be bacterial, viral, parasitic infection. Viral infection, the commonest is rotavirus. Other causes can be norovirus. Then bacterial infections such as Escherichia coli, Shigella, Salmonella, that are infective causes of diarrhea. Now, another cause of diarrhea is malnutrition. Severe malnutrition in children under 5 can predispose them to diarrhea disease in children. Thank you.
All right, thank you very much, doctor, for that. So, what are the key symptoms parents and caregivers should watch out for when a child is suffering from diarrhea?
Okay, the key symptoms every parents and caregiver should watch out in any child with diarrhea disease is: 1, they should first of all watch out if the child passes watery stool for over greater than 8 times or greater, a lot of episodes of watery stool in 24 hours. They should check if the child is febrile with temperature greater than 37 degrees centigrade, if there are symptoms of and signs of the abdominal pain, cramp, abdominal cramp, or passage of blood in stool. They should also check out for signs of dehydration, such as for infants, sunken anterior fontanelle, sunken eye, reduced urine volume, and the child will be irritable and lethargic.
Thank you, doctor, for that. For our viewers at home, so what are the treatment options available for children suffering from diarrhea disease?
Because the gold standard and the first line treatment of diarrhea disease in children is the rehydration. For any child with diarrhea, the first thing we should do is to rehydrate the child. This is because rehydrating the child will prevent the child from severe dehydration, which is the key things that kill most children with diarrhea. The rehydration, the first, if it's for mild to moderate dehydration, we can rehydrate the child by giving the child oral rehydration salts or oral rehydration therapy, which is ORS. Then for severe dehydration, the child needs rapid intravenous rehydration with either Ringer lactate or normal saline, which is given according to the weight of the child. Then the other treatment of diarrhea, any child with after rehydration, the next thing is we should give the child some antibiotics to tackle the causative agent. We should also give the child proper nutrients and also some micronutrients such as zinc in order to reduce the episode of diarrhea in these children.
Okay, thank you very much, doctor. So, how does diarrhea impact the overall health and development of children?
Severe diarrhea, especially the ones that is prolonged, that lasted for several days, it can affect the child severely in terms of causing growth retardation in the child. It can cause cognitive impairment in the child. Most of these children, if they have severe dehydration and associated with severe diarrhea, it can affect the child's development and growth.
Okay, thank you very much, Doc. So, what are the preventive measures we viewers at home take to protect their children against having diarrhea diseases?
The major preventive measures every caregiver parents should take in order to avoid diarrhea in their children is proper sanitation and personal hygiene, encourage hand washing, hand washing. There should be exclusive breastfeeding for every child for the first 6 months of birth. There should be rotavirus immunization and adequate immunization for age. There is proper personal hygiene, hand washing, and everything in order to prevent all these infective organisms being transmitted through fecal oral route for the child during preparation of their feed.
Okay, thank you, Doc, for that. So, what is the importance of access to clean water and proper sanitation in reducing the prevalence of diarrheal disease among children?
Clean water is said to be a very safe water. Proper sanitation will help in order to reduce fecal oral contamination that can lead to the cause of this bacterial spread in a bacterial spread which can cause this diarrhea. So there is need to promote adequate provision of clean water, proper sewage disposal, and personal hygiene. It will help to prevent diarrhea disease in children.
All right, thank you, Doc. So, what is the role of healthcare providers and the community health workers do they play in educating our parents at home about preventing and the treatment of diarrhea?
Every healthcare worker, every community healthcare worker should be able to properly educate the mothers properly on personal hygiene and the need for immunization for every child, especially rota immunization. There is need to educate mothers on exclusive breastfeeding and all the preventive measures in order to prevent diarrhea disease in children.
All right, thank you, Doc. So, what will be your last words for viewers at home?
The last word I have for my viewers at home is need to make the correct diagnosis of diarrhea in children. Every mother should be educated on diarrhea, on the signs and symptoms, the preventive measures, and the treatment which is needed to prevent diarrhea in children, to prevent the severe dehydration. Because, as we all know, most children that die of diarrhea disease is due to severe dehydration. So, every child with diarrhea should be taken to the hospital, should be referred to the hospital immediately to be rehydrated in order to prevent severe dehydration, which can be the major cause of diarrhea associated mortality and morbidity in children, especially the under 5.
Thank you for joining us on today's topic on diarrhea, and we hope to see you next week on our YouTube channel. Don't forget to like, share, and subscribe. Turn on your notification button for regular updates on top notch topics here on Week Clinic every Mondays. Thank you and have a great day.
Subscribe to my channel.